when it comes to the air we breathe, there's a hidden danger that's not as widely understood or monitored as it should be. It is PM2.5. This fine particulate matter, smaller than 2.5 micrometers in diameter, is a significant health risk, far outweighing many of the other pollutants measured by the Air Quality Index. PM2.5's invisible nature doesn't diminish its impact. These particles, due to their size, penetrate deep into the lungs and into the bloodstream, affecting not just the respiratory system, but the heart and brain as well. The health implications are severe and wide-ranging, from increased respiratory ailments and heart disease to impacts on cognitive function and mental health. In this segment on pollution health, brought to you by the Lumen Foundation, PM2.5 deserves our undivided attention and action. In this presentation, we have prepared 3 tables for you that will help you understand the importance of PM2.5. In Table 1, we explain the differences between the common metric AQI and the more significant one, PM2.5. The important message of this table is that the AQI, instead of broadening and generalizing the markers for air pollution, somehow dilutes the emphasis on the more harmful pollutants that are measured by PM2.5. The AQI does give a general idea of air quality and can be useful for daily activities, but several of the larger particles included in AQI are trapped in the nose, whereas the minute PM2.5 particles come in contact with you, they can enter the bloodstream. PM2.5 presents a direct measure of the most harmful pollutants, whose concentrations directly correlate with health-related risk. PM2.5 is therefore the index you need to measure to protect your health if you have pre-existing health conditions. Between the two measures, AQI and PM2.5, it is PM2.5 that provides precision and specificity in identifying health risk and precautions that may be instituted to combat the pollutants. Now, let us focus only on PM2.5. Table 2 enumerates the 5 particles that are included in the list of PM2.5 pollutants: sulfates, nitrates, organic compounds, metals, and dust particles. It is also important to recognize the sources that emit these dangerous particles, as it will help us to develop strategies to weed out the pollutants. These emitters include heavy industry, power plants, vehicles, crop burning, and construction. As is evident, this group includes destructive processes that can be controlled, if not altogether eliminated. Finally, this table helps us understand the diseases and body organs that are affected by the PM2.5 pollutants. The purpose of highlighting this association is to create a framework for eliminating these pollutants and curing disease and disability. The principle remains clear that shutting the eyes or looking away doesn't help the problem. The solution starts from identifying and accepting the problem. In Table 3, we proceed to understand how the levels of PM2.5 can be categorized into the level of risk they impose. This table is somewhat similar to the one created for AQI and has 6 levels of risk based upon the level of the PM2.5. As the level of PM2.5 rises, there is a linear relationship to the health risk that is posed. Based upon the associated risk posed by these levels, there are appropriate measures to protect our health and well-being. Given the gravity of this issue, monitoring PM2.5 should not just be a recommendation. It should be mandatory, integrated into our daily lives as much as checking the weather. Inexpensive and widely accessible monitoring devices for PM2.5 for both indoor and outdoor environments are essential. Every home, car, and public space should be equipped with these monitors, providing real-time data crucial for making informed health decisions. It's high time for our smart devices to become pollution smart as well. The urgency to adopt comprehensive PM2.5 monitoring is not just about individual health, it's a public health imperative. Real-time data on PM2.5 levels can help us avoid exposure on days when levels are particularly high. While the long-term data collection can guide policy and initiatives aimed at reducing sources of PM2.5, we need to target the right enemy and strategize with global collaboration, helping a direction to this pressing global public health emergency.